Hi, Blood Talk fans! Now that we have identified our organisms, our battle is far from over because we have to perform susceptibility tests to identify what antibiotic we can use. There are a couple ways to perform susceptibility tests besides using instruments such as the diffusions or the e-test. I already have video about them, so please check them out at the end. However, ending here won't be complete because we haven't talked about antibiotic-resistant bacteria, more specifically, Methicillin-resistant Staphylococcus aureus, or MRSA. We're also going to be talking about the rapid test that we use to detect MRSA. Without further ado, let's get into it. Penicillin have been an effective agent in treating Staph aureus infections. However, resistant strains to penicillin, including methicillin and all other beta-lactams, have emerged, and MRSA is one of them. What tests do we perform to confirm that the patient has MRSA? Since the productions of the PBP2 is used to determine the resistance, the test we can use to evaluate its presence or absence is to check for the presence or absence of PBP2. This test called PBP2a test. What is PBP2a? PBP2a is a peptidoglycan transpeptidase that can interact with the transglycosylate domain of the PBP2a of Staph aureus. These combinations will cause the bacteria cell wall to catalyze in the presence of beta-lactam antibiotics. This will cause the bacteria to be resistant and enable survival and growth of the bacteria. This is because the antibiotic cannot enter the cell. The bacteria cell walls become impermeable to the antibiotic. How common is MRSA? MRSA is a common hospital-acquired infection. Approximately 5% of patients in the United States hospitalized can carry MRSA on their nose, their skin. MRSA can also be isolated from the patients with catheter. How can I prevent an MRSA infection? As common as MRSA is in the hospital, there are ways that we can reduce MRSA transmissions. Here as follows. Number 1. Maintain good hand and body hygiene. Clean hands often, especially after touching a patient and before touching the next patient. As a patient, you can contribute to this as well by keeping your hand clean and avoid touching your wound. Number 2. Keep cuts, scrapes, and wounds clean and cover until healed. Number 3. Get care early if you think you might have an infection. There are laboratories that use PCR to detect MRSA. However, we do have rapid tests that cost less, that is more cost effective, and get the result faster. And those are the tests that we will be talking about it today. PBP2a test is qualitative in vitro test. There are different methods such as agglutination or immunochromatography membrane for the rapid detections of penicillin binding protein 2a. PBP2a test agglutination method. You will mix the test organisms and the reagent together on the card. Then rock the card for up to 3 minutes to look for agglutinations. If the agglutination is seen in the test, but not in the control latex within 3 minutes, means it is positive and you have MRSA. If no agglutinations in either latex and the test organisms, then you have negative MRSA and the test organism is not MRSA. However, if you see agglutinations in the control latex, that means the test is invalid and you will have to repeat the test. There are some limitations to this type of testing. True positive results generally have strong reactions, and false positive reactions have been known to occur rarely, but are generally limited to weak reactions. Such results can be verified by retesting with a fresh culture. False negative results can occur if insufficient culture is used for the test. In such case, the test should be repeated with sufficient culture. Some organism strains may have a lower level of methicillin resistance, or in rare case, produce PBP2 in low amount and can cause false negative results. Another method of rapid detection of MRSA is the immunochromatography membrane. In this method, we will use highly sensitive recombination monoclonal antibiotic fragments to detect the PBP2a protein directly from the bacteria isolate. You will add the reagents and the test organism into the test tubes, mix well, insert the test strip, and wait for 5 minutes. If you see two lines means a positive test. A positive result means positive for PBP2a. Or if only the control line show up, it means it is negative. A negative result means negative for PBP2a. However, if only a sample line show up, the test is invalid. Invalid means you will have to retest the sample. That's all I have for today. Did I miss anything? If you have any question, please let me know. I'm more than happy to answer them. If I don't know, I will try my best to find out for you. Also, keep in mind that the information I put together here is the general practice at the moment. As time changes, certain practice may change, and different institutions may have different policies. So please keep an eye out for that. If you like my video and think it's helpful in any way, please share it with your friends, and I shall see you all next time. As always, remember, your blood tells you the story of your health. Thanks for watching. Bye!